it's Sarah here from BJC Health, coming to you from Sydney, Australia. Thanks for showing an interest in one of our educational events. You're about to watch part one, so enjoy the event. If you've got any questions about the content, then please consider joining BJC Connect, where you can access all of our facilitators live. Otherwise, please consider leaving a comment and we'll do our best to get back to you.
We call this empowering your journey and getting the most out of your rheumatology care. And I thought of talking about this because, I'm a doctor, but I'm also a patient. And I also have family and friends who are patients. And, often my friends or my family talk to me about, seeing particularly their specialists, I guess GPs as well, and often feeling a bit frustrated or feeling like I have so much to say. I wait 3 months to get into my specialist, and then I've got 15 minutes and I feel like I just can't get everything out that I need to say. And I feel like the time goes so quickly. And, and I understand that. And so I'm often talking to people about, what can you do to make sure that that time is spent, the best possible use of time. So that's what I'm going to be talking about today. And, I'd love your input because, we might get some really interesting ideas from everybody listening. So the basic principles here is that as the patient, you are the boss of your health. You're the boss of your health, your treatment, and who you decide to be in your team. And, we may be the boss of understanding, the science behind it, the medicine behind it, but at the end of the day, you're in charge of your own health. Our job, my job as a rheumatologist, is to help you live and feel better. And I have specific skills and knowledge that I've built up over years. And my main aim when I see you is that I want to help you be better, right? But when we enter into a consultation, we can have different priorities. And we need to align those priorities often in quite a short space of time. So what I want to get out of the consultation and what you want to get out of the consultation may be different. But as I said, you're the boss, right? So the consultation is a brief snapshot in time. So we need to optimize that time discussing whatever issues we can help you with. But we also want to help you with tools to help you in between consultations. So let's give an example of when I say our priorities may not be the same. So for you or me, when I see my doctor as a patient, I'm thinking, I want to discuss my leg pain. I hate this medication that she's given me. I don't want to bring it up because I think she might be offended if I tell her that it was a bad choice. She's telling me that I must be feeling better, but why do I feel so bad? Stuff is going on at home. Should I bring that up in this consultation? I've traveled 2 hours to get here. I'm exhausted. I've got so many things that I want to discuss. She recommended that I see the exercise physiologist, but I've got so many appointments and I can't fit it in. And so as a patient, that's what you're thinking about. I'm thinking, I need to fill out the documentation for the prescription today. I'm really worried about these blood tests and we're going to need to discuss those. The joints are much less swollen. She seems to be getting better. Maybe the blood tests are better, but can see she's not happy with the treatment. I recommended that she sees the exercise physiology to help with fatigue, but why didn't she start that? I know she's still smoking. I'm worried about that. Should I bring it up again? In this time, by the end of it, I need to make sure I write a clear letter to the GP. I need to get the right blood tests. I need to motivate her to start exercise because I know she'll feel much better. So you can see that, we're both thinking things that have to align in a short space of time. And I think that can be quite tricky. And I don't know if any of you have had that feeling. I'd love to hear in the chat box if this kind of resonates with you. But I know as the specialist, I'm often thinking that this is the situation. So how do we optimize every consultation? I think one of the most important things is that I, as the doctor, really need to know at the beginning, what are your priorities and concerns? So sometimes as a patient, we hold on to that and it might only come out afterwards, but it's really helpful if you can be specific, Hi, I've come in, I know I need to get my prescription, but I'd really like you to have a look at my foot. That's my biggest issue. And I also want to discuss the side effects I'm having with my medications. Write them down before you come in. Then we know right at the beginning, we have a signpost. We know where the consultation's heading. I know what you want to talk about, and we'll make sure we try to fit that in. consultations can be overwhelming. And I always think in medical consultations, for me, that's pretty easy because I'm a doctor, but I know when I go and see other professionals, like for me, the worst is seeing an accountant. So if I see an accountant, I listen to them and I can't understand anything they're saying. And they're talking and they're talking and they're telling me all these things I have to do. And I'm very overwhelmed. And I nod, yes, I understand everything you're saying. And I walk out. But really, I haven't understood very much. And I don't know if you have the same feeling sometimes seeing a doctor. So it can be helpful to write notes as you go. And probably most importantly, if you can, to have a support person with you who can write notes or who can just understand and then feedback. Because I think when things do get overwhelming, often we tend not to hear the important messages. So I think that's a really important aspect. Help us by having any results on hand. I think for both the patient and the doctor, it can be really frustrating when we're spending that important consultation time running around trying to get results. Sometimes it's unavoidable, but if we can try and avoid it as much as possible, that's good. So I don't think any specialist can use my health record at the moment. So we don't actually have instant access to all results. We can certainly look for them. I mean, we're lucky at BJC Health. We do have access to quite a few of the different providers, like some of the X-ray providers, but we don't have them all. And so we really want to make sure we have those results. If possible, if you've had tests done, if you can just particularly if I haven't ordered them, maybe your GP's ordered a test and you'd like us to have a look at it. So just let us know. So either bring in the result or just let us know. I had an X-ray at this specific place. Could the reception please get the result before the consultation? And as I said, if the GP orders the test, we often will not get the results. So let's sort that out before we get into that consultation. If you need to have blood tests for the consult, try and do it at least a few days prior, because often people go in maybe the afternoon before, and the pathology company will always say to you, yes, the results will be available tomorrow morning, but often they're not. And of course, that can frustrate everybody. So as much as possible, if you can get those tests done beforehand, and if we can get the results, that will make things move much more quickly. How do we optimize every consultation? So yeah, do your homework. So, my patients will know that at the end of the consult, I'll often give them a bit of homework. But that might be things like reading about some medication that I'm thinking of starting you on, or about the disease itself. And it can be really useful if you actually spend time looking at that. That means that when I see you, we can have a much more streamlined consultation, because you've already had to think about these things. Write a list of questions and bring them in. Because our job is to make sure you know exactly what you've been prescribed and why. And some of you may say, you know what, doctor, I'm just going to trust you. I don't really care about reading about the medications, and that's also fine. But ideally, we like you to be pretty well informed about the medications. As I said, have any investigations that have been organised. Look through any educational material that was given at the last consultation. Bring in questions so we can get the most out of every consultation. Sarah, I can see there's a few things in the chat. I don't know if you want to talk about that now, or should we do that later?
I can ask one. I think Jenny asked a great question. How do you feel about patients recording your consult? So I guess now with mobile phones, all of us can record a conversation. I've actually got no idea how you feel about that, or whether you've had clients ask you to do that before.
Yeah, definitely. And I think it's probably, I don't know what the legalities are, right? So it may be that you're allowed to record every consultation. I don't know. I think the thing you can't do, and the thing that I think would upset every doctor, would be if you're recording it without asking, without telling, right? So that would be something that you're not allowed to do, right? So, it's important to actually disclose, hey, I was thinking about recording the consult. Is that okay? For me, I'm really happy for that to happen. I have no problems. I think it can be really useful for the patient to then, you know, listen to it afterwards. But I think it's important to ask the specific doctor, you know, how they feel about it.
Mm-hmm. Another question is, how do we get specialists to communicate with one another? Or again, maybe you can give a snapshot about how you go about, communicating with the different people involved in someone's care. It's a good question.
This is really hard, isn't it? Because, you know, I always say to people, I can only control what I do. So I can only control that I always write letters to the other specialists involved. Sometimes that will mean ringing the other specialists, but I can't make other specialists write to me, right? So I think the most important thing probably is when you see a specialist, that you ask them, you know, it's really, can you please make sure you send this letter to this doctor? I love to give my patients my letter and then they can bring it to everybody. So you could also ask the other specialist, you know, are you able to give me the letter of consultation so I can share it with my other specialist? What we probably don't do it enough, and is spend a lot of time ringing around and ringing the other specialists, and that just comes down to time, you know. So if it's something that's really important and you know really critical to discuss, you know, I want to start this medication but it may interfere with the other thing, then a phone call can be useful. But really it can take a very long time, and you know it can be, we can play a lot of phone tag, but yeah, I think you can just ask your specialist and let them know how important it is for you. Yeah.
Perfect.
I think I've just missed a page and I'm trying to work out how to go back. So just bear with me. There we go. Yeah, so this is important. So when I see you as a patient, I want to offer you the best rheumatology care. And the reason I'm bringing up is that my patients will often talk to me about issues outside of my expertise. Now, that's really important that we know what's going on in terms of health. So I really need to know that you've just had a cardiac issue, or that, you know, that's we have to know that. And we really want to know everything that's going on with the other medical issues. But often patients will be asking me to help manage those other medical issues. And we can spend time talking about that, but that's then taking time away from what I'm good at, right? So when your specialist kind of starts to veer away from wanting to talk in detail about another medical problem, that's usually why. It's not because they're not interested, it's that that's not their field of expertise, and they really want to use that time that they have together with you to optimize, you know, your rheumatology or whatever specialty it is, that problem. So this is talking about communication between team members. We just talked about that. So it is really important. Please ask other specialists to copy their letters. And if you have seen another specialist, you know, we're also happy to get that letter of consult. So we can actually ring the other specialists, secretaries, receptionists, get the letter sent to us. We have to know, you know, we've got to know beforehand, but we're happy to do that as well. And we do think it's important. So try and, if you can, keep your own records. You'll feel empowered if you've got your own health records organised. So things like having a document folder with separate areas for maybe, you know, specialist letters, x-ray results, pathology results, an up-to-date list of medications. We're always happy when we see that, because it just makes it so much more streamlined. You know, we can really get to the heart of the problem without running around chasing things. So and it helps you. You know, you will feel like you're in control if you have those records collected like that. So I wanted to talk a little bit about consult times, because I think that can be a bit confusing, because specialists do work very differently to GPs. So you'll be familiar with GPs having kind of a time-based consult system. So they actually have to work out for each patient how long they're spending, and their consult fees and their billing is different according to how long they spend. So specialists don't do that. We just have a set consult fee. So most rheumatologists, most other specialists as well, will have a long initial consult, anywhere between half an hour and 1 hour usually. And most rheumatologists will have a 15-minute follow-up consult. Obviously, sometimes it lasts a lot longer if you're unwell and if there's more things to discuss, but in general, that's how patients are booked in. But sometimes people need a longer consult. So if you feel that that 15 minutes is just not enough for you, and you feel that, you know, I've got much more to tell you, there's no way it can fit in 15 minutes, we do offer like an extended consult. So you just have to book that in. So that's just something to discuss with the receptionist. We don't want to rush you. Sometimes, and I know I felt like that as well, sometimes there's that feeling that you're being rushed. And it does come down to just having a set amount of time to get everything done in. But you know, I hope that, you know, you're not feeling that too often with your specialist, but I do understand that that is an issue that can frustrate people. So, you know, we have the Australian Rheumatology Association, so they're the body that kind of cover all rheumatologists. And this is just an example of what we call clinical care standard. It came out quite recently, where sort of group of rheumatologists, but, you know, patients, other stakeholders kind of all came together and said, what are the minimum main standards that Australians with rheumatoid arthritis should expect when getting care for their condition? So this is for rheumatoid arthritis. And obviously, many of you will not have rheumatoid arthritis, but it's just an example. And I think that some of these things would be applicable to different conditions. So there's a lot of points in that. And, you know, if you want to have a read of it, you can go to the Australian Rheumatology Association, have a read of it. But some of the things that are important is that they say all patients should have access to supportive resources. Interestingly, you know, here we are at a webinar, hopefully giving you a supportive resource, but, you know, this is one of the points that's made, that all patients have a right to have their disease monitored, to have advice between the rheumatology appointments, and to have support to engage in physical activity. And to go into that in a little bit more detail, there are many supportive resources. Now, we're talking right now about rheumatoid arthritis, but we have similar resources for most of the rheumatological conditions. And as an example, we're quite proud of this BJC Connect, and this is why it was formed. But there's Arthritis Australia, there's creaky joints, and each disease has a support group. And I've just put here a little screenshot of the resource tab. You know, you're at the moment in BJC Connect, right? So the resource tab, and let's see if this works, but just, you know, if you're someone who wants to look at the rheumatoid arthritis resort, you can see that in the middle of the page. And, you know, we go through, we open up the rheumatoid arthritis tile, and we'll see all of these many different resources, right? Some of them will be relevant. How do you deal with overwhelming fatigue in rheumatoid arthritis? All about methotrexate, all about exercise. So when you have questions in between your consultations, you may well find that the answers are in this type of resource. It can be a bit tricky. You've got to go through it. You've got to look for it. But for example, for rheumatoid arthritis, you're going to have a lot of answers to your questions just by looking into this resource. And this is only one resource, you know. All the other ones all have similar types of support for you. I'd love to know, you know, in the chat box, whether you found any supportive resources particularly useful. Maybe you want to share them with your with the other people here. One of their points is that patients do need to have advice, access to advice between rheumatology appointments. So you come in for your 15 minutes and you may see the rheumatologist every 2 months, or every 6 months, whatever it is. There's a long space between that, right, where you may want to learn things may be going wrong, you may be getting side effects. You may need to come in earlier. We may make an appointment in 4 months, but actually that's not good enough. And often with specialists, there's no room to move. You know, the specialist books you in 4 months. Kind of doesn't matter what happens in between then, because you just got to wait the 4 months. And so we certainly try very hard to make sure there is some sort of access to advice. So the first thing is that if you can get our consultation letter, it will often outline the details of the management plan. So I find often when people are a little bit confused, and I kind of say, can you just go back to that letter and there's a plan, then it's really clear. It may not be clear, but you know, there usually is some sort of plan there. There should be a plan there to help you understand what needs to happen. As I said, BJC Connect does have a lot of information about most conditions, symptoms, medications, and side effects. You can contact your rheumatologist about any important changes, like flares or side effects. Every rheumatologist will have a different way of you contacting them. Mostly at BJC, that's through our reception, and the receptionist always sends us the email. Sometimes patients will ring up. Often, you know, it usually works. Things sometimes fall through the cracks, but it should work. And it's our responsibility to make sure that you do have that access. Also, don't forget your GP. So your GP has a lot of knowledge about everything, right? So they're the specialist in everything. So things like, you know, feeling unwell, you're not sure if it's a side effect or do you have an infection or something. Often the GP is really the best first place to go, because they can advise you, you know, is this a rheumatological issue? Is this a completely separate problem? So I just want to make sure that you don't forget the importance of the GP.
So you've just finished watching part 1 of one of our recent educational events. Hope you enjoyed the content. If you'd like to access part 2, then you need to sign up for BJC Connect. It's a free platform where you can access not just the recordings of past events, but also access a whole range of upcoming future events and access our team of facilitators live. All of the details that you need to join BJC Connect are now flashing up on your screen. But otherwise, like our staff, subscribe if you'd like to see more information from BJC Health. Look forward to seeing you in an event soon.